We have a guest visitor who snuck in. Dr. Peter Hotez has graciously given a few minutes to all of us this morning to do kind of a fun Ask Me Anything segment. And so, Dr. Hotez, before we get started, I just want to do a time check with you. How are you on time? We've got you for 10 minutes, but I wanted to make sure that we are not running into any news appearances.
I'm good. I'm good to the bottom of the hour.
Okay, wonderful. So let me just give a brief introduction to Dr. Hotez. He is no stranger to TIP, and I'm sure he is no stranger to all of you. But Dr. Peter Hotez is a professor of pediatrics and molecular virology at Baylor College of Medicine here in Houston, where he is also co-director of the Texas Children's Center for Vaccine Development and an endowed chair in tropical pediatrics. He is a vaccine scientist who led the development of vaccines to prevent and treat neglected tropical diseases and coronavirus infections. A new Texas children's COVID-19 vaccine is being accelerated in India right now and is undergoing clinical testing. So Dr. Hotez and his team are in the thick of things, even in the research for finding a COVID-19 vaccine. Dr. Hotez attained his undergraduate degree from Yale University and his MD and PhD from Weill Cornell Medical College and Rockefeller University. He is the author of more than 550 scientific articles indexed in PubMed and 4 single author books. He is also an elected member of the National Academy of Medicine and American Academy of Arts and Sciences, and has been honored by PAHO and the WHO, Research America, Benign Birth, American Society of Tropical Medicine and Hygiene, and other organizations. He appears frequently on major news outlets promoting global health and vaccines and immunizations, as well as seems to be the leading face of countering anti-vaccine and anti-science movements. And so again, Dr. Hotez, welcome. If you want to share a couple of words with the group, please do so, but we've got some really great questions lined up for you.
No, that's fine. It's a real honor to be able to speak with everybody, and you guys are all heroes championing vaccines here in Texas. I know this has been an awful battle and struggle the last few years, and unfortunately, it looks like it's not going to get much better now that the anti-vaccine and health freedom forces have now added on protests against masks and social distancing. So what was an anti-vaccine movement is a full-on anti-science movement and doing a lot of damage, and that's their intention. And so I really appreciate all your efforts.
Well, and we thank you for everything that you're doing out there in the media to support our work by putting a spotlight on this, and hoping everybody will come back to reason and logic. So the first question we have is from one of our advocates, and he asks, Dr. Hotez, you've written before about incentivizing scientists to speak more publicly regarding their research in an effort to increase communication between scientists and the public and reduce anti-science sentiments. I was wondering if you've had or seen any success in lobbying some institutions to change the standards or expectations of their faculty to incentivize this public engagement? And how do you think we can best encourage institutions to adopt these standards?
Yeah, no, it's an important question because it's just not in the DNA of our profession, either in the science profession, when we train PhDs or postdoctoral scientists or physicians in residency training, we don't teach public engagement. We don't teach how to engage in the public. In fact, when I was getting my MD and PhD, it was more than just frowned upon. It was actively discouraged. You were told you don't engage the public. You don't talk to journalists. That was seen as self-promotion or grandstanding. And this is one of the reasons why we have this vacuum right now. And all those ideas were put in motion before we had something called the internet and social media, and it's causing a lot of damage right now for our nation. That it's created this vacuum of not having scientists and physicians, and we'll have this full on anti-science movement right now that dominates the internet with more than 480 websites all revved up on social media. When you go to Amazon now, you go to Amazon.com, it's an anti-vaccine website. It's all peddling fake anti-science, anti-vaccine books. So it's put ourselves in a very dark place. And I think, there's lots of things we can do. And one of them is retooling scientists and physicians to know how to do that public engagement. But you're not seeing a lot of enthusiasm from that coming from the leadership of academic health centers. And I think part of it is Office of Communications from academic health centers like to control the message. They're all about protecting the institution. They're not so much focused on taking on issues of social injustice or combating anti-science movements, and figuring out how we can change that around a bit and even encourage it. So, for instance, I get evaluated every year as well, and like anybody else, and on my forms, it's all about my scientific papers and grants. Nothing about being on TV, or nothing about writing op-ed pieces like I did last weekend for the Houston Chronicle. None of that is encouraged. Even writing books is not encouraged. It's all about grants and papers and the number of patients you've seen. So how we kind of fix that is going to be really important, I think, to solving this dilemma that we have, in which we've seen it, right? We've seen how parents and now those thinking about taking a COVID-19 vaccine are just inundated with misinformation coming from dedicated organizations like Texans for Vaccine Choice that want to promote this kind of stuff.
So along those lines, obviously you dove right into the storm of COVID-19, and is one of the major experts and spokespersons nationwide and globally, through the different news outlets and cable news shows. With this role, an advocate asks, have you had any backlash because you have been so vocal and kind of staunch in your beliefs and in your recommendations?
Well, yeah, I mean, all you have to do is follow me on Twitter, and you can see it all play out on a daily basis. And some of it is coming from the far right wing of the Republican Party, the sort of link to political extremism. Others have used awkward language, and I'm pretty convinced that's coming from the Russian government and the Kremlin, um, accusing me and Tony Fauci of being bowling buddies, bowling partners. I think I tweeted something like, "I guess that's what they do in Minsk and Novosibirsk. Is bowling is a big thing there." Um, and then even members of the Texas legislature. I mean, I still, on a not frequent basis but regular basis, get pretty ugly tweets from sitting members of the Texas Freedom Caucus, and so there's a lot of aggression out there. Not to mention all the emails, the terrible, terrible emails that I get on a regular basis. So it's a tough space, and the scientists don't get a lot of backing. And now we saw how scientists are deliberately being targeted as well.
So how do you handle that? How do you kind of retreat and sort of reground yourself and refocus? Because we do see a lot of the backlash that you unfortunately experience. How do you
Yeah,
unplug, I guess is the question.
well, it's hard to, and you try to recognize that it's that that science has never been so politicized before. Anti-science has never politicized before, and this is something bigger even than a personal attack on me. it's a systematic disinformation effort that was started that really that's always been around, but it really amplified by the White House over the summer when they specifically started targeting scientists, but also it launched the disinformation campaign calling COVID-19 as a hoax and trying to attribute COVID deaths to other uh, causes, discrediting masks, and uh, that has become a real concern. It's actually leading to so many deaths in the United States right now that it's actually the first time we've had deaths by anti-science, at least on this scale. So my going up against it, I knew what I was getting into, and the hard part is, the so many people say, well, you got to stick to the science, and you do as much as you can. The problem is, they're the ones who politicized it, right? They're the ones who linked going up against science to a central tenet of their political activities, and there's just no way to disentangle it. You have to call, to really combat the anti-science, you have to call it out, and it's been tough going to war all year now with the White House Coronavirus Task Force and all of their allies, which includes organizations, unfortunately, like Texans for Vaccine Choice and that whole health freedom movement.
Mhm. Yeah. So kind of moving into a few positive notes, and I know we've got time for probably just a couple more questions. Good news has been coming out for the past couple of weeks in terms of COVID-19 vaccines, and Governor Abbott announced last night that Texas is going to receive close to about 1.4 million doses. I guess by next week, December 14th. So a question came through. Have you heard where the FDA is on granting emergency use authorization, since we have to wait for that before vaccines can be administered?
Well, the Burback meeting is December 10th. So, in theory, if Burback gives it the green light, and I'm guessing the FDA would not have brought it before Burback unless they knew it was going to get the green light. I would think within 24 hours, FDA can go ahead and start moving it out. So I think it may happen as soon as that. I mean, um, there was a delay compared to the UK government because they had to go through an extra review process. The FDA has been carefully looking at all the raw primary data to confirm that everything that the companies have said is true. Remember, the only information we know about this vaccine is really through, well, there's the phase 1 data that was published, but other than that, it's all company press releases. And when companies write press releases, they're not writing them for you or for me; they're writing them for the shareholders. So this is the first time that the FDA has really had the chance to go through the data, which they're doing in detail now. And the hope is that it all checks out. It confirms the company press release statements, bring it before Burback, and within 24 hours, they can start releasing it to the public. And then we have the Moderna FDA Burback review on December 17th, so that by the end of the summer, sorry, the end of 2020, we'll have 40 million doses available nationally. And that means 20 million people can get immunized because it's 2 doses, 3 to 4 weeks apart. But other vaccines are going to follow, so that by the early part of next year, we may have 4 or even 5 vaccines. And we're now accelerating a vaccine across India and scaling up production there. So we're going to have a pretty complicated and interesting vaccine ecosystem starting in a few months. And the point is, things will get better as we start vaccinating the public.
And then could you just take a minute for our audience just to explain what Burback is? Because some people may not be familiar with that, you know, subgroup within the FDA.
Yeah, it's a horrible acronym. It stands for the Vaccines and Related Biologics. I don't know who thought of that advisory committee. And it's kind of the oversight committee of external independent review from the FDA to kind of to confirm that the FDA's ruling looks good. And then there's another group called ACIP, the Advisory Committee on Immunization Practices that runs out of the CDC that looks at recommendations for indications for the vaccine, and in this case, what groups should be prioritized for receiving vaccines. Having said that, these are federal committees, and a lot of the control, though, for vaccines really does reside with the states. So, in the end, it's going to be up to the states to decide on the prioritization of different groups. And I think TIP can really have an important role there if they're seeing something that doesn't sound quite right with what the states are deciding. Uh, in the past, the states have pretty much uh, rubber stamped anything ACIP has done. There's no daylight usually between the state recommendations and ACIP. I don't know with this very politicized environment whether that'll still be the case.
Okay, wonderful. And then our last question is, you have done so many interviews, and I'm sure you are getting ready to hop on another news segment very quickly. But an advocate asks, out of all the interviews you have given, who were you most excited to interview with?
That's a tough one. Uh, huh. Well, first of all, I love all the anchors on CNN and MSNBC. I like the Fox anchors too. They've been terrific. I I I love being on all of them. Certain ones are especially stimulating for me. Nicole Wallace is always really good. I think Chuck Todd's really smart. I like being on with them. Wolf Blitzer's been very kind to me over the years, and so that's always an honor. Um, uh, the Joe Rogans are a lot of fun. That's always you never know what you're gonna get. So always being a little bit surprised is has been good. Uh, I just did the Fresh Air with NPR and Terry Gross, and I've always admired her for a long time. So that was really special for me to go on that. So I really love all of them, and you never quite know how things are going to work out. I did Chris Hayes last night. He's always challenging. Rachel Maddow is always challenging as well. The key is that I find is everything is so hyper polarized politically that you want to be careful to avoid going down a rabbit hole because a lot of these cable news channels do have political agendas and not getting swept up in that and trying to really say to yourself each time, am I doing the best I can in terms of what I'm saying that's actually going to focus on saving lives right now, because that's where all the attention is.
Right.
And if you look at where the lives are being lost right now, it's overwhelmingly in the center of the country, the middle of the country. It's mostly red states. I mean, the top 12 states right now for COVID-19, 10 of them are red states. The only blue states are Minnesota and New Mexico. So and there doesn't seem to be a lot of interest in reaching out to the center of the country. So one of the other things I like doing, when you ask about who I like interviewing with, I like the challenge of speaking to people who we may not ordinarily agree with. And so I particularly enjoy the opportunity to go on Fox News and to do the Daily Caller and the DC Examiner, because we've got to fix this in this country. Back when I was living in Washington D.C., we got a lot of things done around legislation for neglected diseases, and I would think nothing of back then in the 2000s of going to Sam Brownback's prayer breakfast meeting and back then Senator, now he's Governor Brownback of Kansas. Before then he was senator. Very far to the right. And then I'd walk across the hall and go to see Senator Leahy from Vermont, who's a little bit to the left of Karl Marx and his political views, and getting them to work together for neglected disease legislation, no problem. People put aside their ideologies in order to get stuff done, and that doesn't happen anymore, and that's really scares me about the country. And so there's that vacuum here of people who are willing to work with both sides, and that's what I'm trying to do. And um, But I do have to say the Texas Freedom Caucus does have its moments, and they are a very tough group. But uh, but we keep trying, and Rake, I've learned so much from you over the years on not only the policy but how to interact with lawmakers, and you've been for me a great mentor in helping with that part and filling the gaps in my education.
Well, that's very kind of you, and it is two ways. I've learned a lot from you as well.